Welcome, everybody. For those of you that don't know me, I'm Jake McDonald, the current chair of the Dublin branch. And I'd like to formally welcome you to what is hopefully one of our first events from a remote setting. Some of you may recognize Richelle, know her personally from her activities in Dublin as the acting secretary, but also from YPI. And I'm just going to give those of you that don't know Richelle a little bit of a formal introduction from her background to understand why exactly Richelle has agreed to give us this talk today. So Richelle graduated from Trinity College with an honours degree in natural sciences and a master in nutrition and dietetics, with also a postgraduate certificate in allergy from the University of Southampton. She's a CORU state registered dietitian, and she's been practicing for the last 16 years. She's also been running her nutrition consultancy known as Nutrition Wise for the past 15 years, and has been providing a lot of nutritional clinics for individual clients, consultations to businesses, NGOs, education providers, and all sporting organizations. I personally know, and you'll all be familiar with it after this chat, that Richelle has a wealth of experience and knowledge in working with people to better understand and self-manage their health through their nutrition, behavior, lifestyle changes. And she also has a wealth of communication experience as a dietitian, but also from her prior career in sales and marketing, which she worked in for 11 years. And I always lend on her ear for advice in difficult situations aspect. So she was the president and CEO of the Irish Nutrition and Dietetic Institute, formerly known as the INDI, the professional body for dietitians in Ireland, and has been made an honorary member. She's a founding member of the Healthy Ireland Council and also a past member of the Irish Institute of Sport panel of nutritional advisors. She has celiac disease herself and is also an acting board member of the Celiac Society of Ireland and the chair of the Clinical Advisory Board. As some of you may be aware, she also has Parkinson's disease and is currently the secretary for the Dublin branch for the Parkinson Association, a member of YPI, and also an ambassador for the World Parkinson's Congress of 2022. Richelle is also a founding member of PD Avengers, which some of you may know her from, which is a global alliance of advocates united under the common goal of ending Parkinson's. So she's been involved in media and lobbying to raise the profile of the fundamental importance of nutrition and health for the prevention and management of disease. She's also an active advocate for Parkinson's disease, a celiac disease, which some of you are fully aware of. And through living as a person with both celiac disease and PD, she understands both conditions from both receiving medical and health professional care and delivering care for people with chronic disease. So she's kindly agreed today to bestow some of her wisdom upon us, and we hopefully that some of you will gather some vital information from us. I know for me, for one, I neglect my diet in almost nearly every aspect, but from a Parkinson's standpoint, how influential it can be to managing our symptoms and the disease. So I'm going to pass you over to Richelle now, I believe is going to share her screen and maybe run through some presentation of some sort. And then again, any questions, put them in the chat box, which I'll bring to Richelle after her presentation. And then we'll open the floor to anybody that wants to voice their questions also, okay? So I'd like to formally welcome you to Richelle's chat.
Thanks very much for that introduction, and thanks very much for everybody coming along to hear me speak this afternoon. So as I kind of mentioned in the advertisement for the webinar, we're going to focus on diet and Parkinson's, particularly in light of COVID at the moment. So just as Jake said there, my background is that I'm a dietitian in terms of my work. I'm registered with CORU, which is the regulatory body for health professionals. So it regulates dietitians, physios, radiographers, speech and language, etc. The reason I mention this is it's really important in terms of when you get nutrition advice, particularly for what I would consider a complicated chronic disease, that you get advice for someone who is properly registered to give that advice. So there are nutritionists out there, and I'm also a registered or a nutritionist as well, but nutritionists in our world can't give advice on a one-to-one basis to people with chronic disease. That is because they don't do hospital placements and work in hospitals where they sort of get training specifically around chronic diseases. So I just always like to sort of give a background to that. I suppose, obviously, in terms of Parkinson's, I was diagnosed myself about 4 years ago now. And since then I've been active with YPI and also with the last kind of year with the Dublin Parkinson's branch as secretary. And it was Sinead that I met, who was very persuasive and brought me on board, and I'm delighted to be involved. The other thing then that I did, and it was actually thanks to Gary Boyle of YPI, who shared his experience with regard to a thing called the World Parkinson's Congress, which is the largest basically conference for people with Parkinson's in the world. And one of the key differences for the conference is that it is the largest conference that involves patients as partners. So I went along to it thanks to YPI, a bursary from YPI. A number of us went across to Kyoto last year. Didn't get to see much of Japan, unfortunately, because it was a full packed schedule of research presentations, health professional presentations, and it was phenomenal. So I went as a dietitian as well as someone with Parkinson's. And subsequent to that, I just realized basically how the care we get for people in Parkinson's is not where it should be in this country. We're far behind the care that people get for cancer, diabetes, heart disease. And this is a real problem for all of us, which we, need to all stand up and fight a bit more for better care. So from that, I actually signed up, applied to be a World Parkinson's Congress ambassador for the next Congress, which is in 2022 in Barcelona, which is much easier for everybody to get to. And I would really encourage both, people with Parkinson's and your family members to attend, because you, besides the content that was there that you learn so much from, one of the biggest things was meeting other people with Parkinson's. And I was fearful of going because I just didn't know what I was going to see. But, people are at all different stages of Parkinson's, and they were all coping in their own way. And it was really empowering to see how everyone was coping and living with Parkinson's. And then the other thing, I suppose, subsequent to that is that I met a lot of, a lot of young people with Parkinson's in Kyoto, and they were amazing advocates, and so were many people with Parkinson's of all age groups there. So in the last kind of 6 months, or actually, 6 months probably, a number of us got together and founded a thing called the PD Avengers. So basically, this is in response to a book that was written by 3 neurologists, Michael Oken, who basically came up with deep brain stimulation, has been very involved in the development of that. Ray Dorsey, who's very much a proponent of online telemedicine and also combating things like paraquat in terms of toxins and Parkinson's disease. And then Bas Bloom, who, along with Michael Oken in Kyoto, blew me away in terms of his approach to multidisciplinary care for people with Parkinson's. There's a thing called the Parkinson's Net, which he runs in Holland, and they are so far ahead of us in terms of care, multidisciplinary care. And that's not the health professionals' fault here in Ireland. It's basically we don't get the funding to be able to deliver the same level of care. So there's a thing called the pdavengers.com, and we're asking people to sign up. It's basically to try and get a momentum of people with Parkinson's around the world to start advocating for better care for what is the fastest growing neurological condition in the world. And if we don't stand up and shout for ourselves, no one else is going to do that. And I know that from advocating for people for better nutritional care before I was even diagnosed with Parkinson's. I know from working in the health system, those who shout loudest get heard, unfortunately. And the thing with Parkinson's, we know we can be quite a quiet group. And it has been mentioned by the 3 authors of Ending PD, the book, that it is a problem for us in terms of getting care, is that we're too quiet. So one of the things from the conference in Kyoto that I was really driven to do was to try and raise the profile of Parkinson's disease and a case for greater nutritional care for people with Parkinson's amongst my colleagues. And it was actually through the fact that some of my colleagues weren't really aware of the impact of Parkinson's on many parts of our bodies that need nutritional input, that maybe decide, right, we need to do something about this and change it and educate even my peers as well as people with Parkinson's. So just to show you here, this is an updated model of the kind of images of Parkinson's disease. So the illustration back in the 1800s was tended to be a shaky, old, stooped over man. But thankfully they've changed that, because we know that Parkinson's does not just affect older people, it affects any age. There is juvenile onset, which is under the age of 20, young onset, which is under the age of 30, early onset, which is under the age of 60, 65, and then we've got older onset. So you can see here it affects all genders, ages, and also it doesn't discriminate in terms of colour either, unfortunately. It is non-discriminate. So, sorry, just getting this now. So this here is also a picture that has been actually drawn by a PD Avenger called Johnny Atkinson, who is a UK Parkinson's advocate. He was in Kyoto as well. And he is also, he was an A&E medic who worked for a long time in A&E. He's doing different roles in the medical sphere as we speak. And he's big into creative drawing. And as you may or may not know, people with Parkinson's actually can start to be even more creative, or if you weren't creative before, become creative when you have Parkinson's. So there are some silver linings. But just showing you here in terms of this image, you know, often people think it's just about the motor symptoms, you know, in terms of shuffling along, but actually there's a huge number of symptoms that are beneath the water that many people are not aware of, including health professionals. So if they're not aware of it, then they don't know how to help us. So we need to, you know, tell them. And so you'll see here the things like depression, anxiety, dementia, apathy, mild cognitive memory problems. I was only just researching this morning with regard to Alzheimer's that it can be up to over 30% of people with Parkinson's can develop Alzheimer's as well. There's fatigue, urinary problems, dry skin, sweating, sleep issues, you know, the list goes on. So this is actually also what I wrote in the article for my peers, and it just shows you here again, the non-motor symptoms are shown actually to have the biggest impact on those of us with Parkinson's in terms of our quality of life. So sleep disorders, neuropsychiatric problems, autonomic dysfunction, things like swallowing problems, nausea, constipation, orthostatic hypotension. I've suffered from that myself. Sensory things, you know, visual. I swear my eyesight is not as good as it was, but apparently from 40 on, your eyesight starts to go anyway. But definitely think Parkinson's has an impact on that. Weight changes, just known as we unfortunately progress along and the disease, that we tend to lose weight. So there's a whole number of things there. There's restless leg syndrome, sleeping during the daytime, you know, the list unfortunately goes on. So I suppose from the point of view of diet, I kind of feel it really is one of the key missing pieces from the multidisciplinary care for people with Parkinson's. Hence, I'm always happy to talk about it. So in terms of the topics I'm going to talk about today, gut function, as I say, these are kind of things that I think are really important in general, but also in terms of COVID. So gut function, vitamin D, calcium, protein, omega-3 is a type of fat. I'll touch a little bit on weight loss. I don't really have time to go into that. It's a whole other area in its own. And swallow, again, I kind of couldn't leave it out. So we'll just see how we get on time-wise. So in terms of the gut, a huge amount of people with Parkinson's, it's shown in some research that up to 90% of people with Parkinson's suffer from some kind of bowel kind of discomfort. And constipation is seen as, at this stage now with the research, what we call a prodromal symptom. So in other words, it is a symptom that basically leads into Parkinson's. Not for everybody, but you'll find a lot of people suffer from constipation prior to developing Parkinson's, and that can continue on. So in Kyoto, there was a presenter there who just spoke about the fact that, as you can see here, his range in terms of prevalence of constipation alone was anywhere from 8 to 70%, but on average 40 to 50% of people had just constipation alone. And that was based on subjective evidence. And subjective evidence is basically, you know, someone asking you through a questionnaire whether you think you have constipation or not. So on this particular study, it showed that when they gave people the questionnaire and asked the questions, 32% of people to 38% of people said they had constipation. However, when they actually did what they call that was a subjective questionnaire, when they did an objective scan of their bowels to see whether they were constipated or not, 80% of them were actually constipated. So while 33%, a third, thought they had constipation, actually, you know, almost a little bit less than 2.5 times that actually had constipation. And this has big implications for us with Parkinson's in terms of our symptom control. And that is because if you've got constipation, you can imagine those of you who may be on medication in particular, which is the cornerstone medication is Sinemet or levodopa, really that has to be absorbed to travel to the brain. It's a dopamine replacement therapy because Parkinson's is basically due to a lack of dopamine in our system, in our brain. And lack of dopamine affects pretty much functions all over our body, and that's why we get motor symptoms and non-motor symptoms. So basically, in terms of constipation, you can imagine if you're all bunged up, the tablet's not going anywhere fast, and it doesn't get absorbed, and hence your symptoms don't improve as much as they should do. Or if you have a good regular bowel movements and you're not constipated, then your tablets can be absorbed much more quickly and easily. The other thing is obviously constipation causes some of the symptoms, so things like nausea, because we can imagine if you're backed up and then you try and eat on top, it basically creates nausea. Also, you can find that there's a slowing of the gut, and particularly if you're constipated, it can cause, it's a kind of a chicken and egg, because basically Parkinson's itself can cause slowing of the gut, and then that worsens things, and then you get bunged up as well. So there's a whole lot of ramifications in terms of constipation for us, for people with Parkinson's. And the other thing, some people, if it's really bad, can get basically a blocked gut, and that is really dangerous, and we want to avoid that. So in terms of what do we do about it is the question. So how do you improve your gut function? Well, one of the key things that we find without people without Parkinson's is they're not taking enough fiber in their diet. Fiber is the key thing to help move and stimulate gut motion, and to stimulate us to be able to pass a bowel motion. So we need to be getting in between 25 and 30 grams of fiber a day. So most people in Ireland are getting nowhere near that. They're probably maybe getting 15, maybe at the push, no pun intended. So basically, you need to have a look at your diet and see if you're getting enough fiber in. And it needs to be two types of fiber, soluble and insoluble fiber. So soluble fiber is basically what gives the sort of softness to the stool, and insoluble fiber is what gives the roughage and kind of helps, it's nature's broom, helps to kind of clear you out. But you need the soft fiber to kind of allow that to move a little bit easier. So in terms of what is soluble fiber, so basically soluble fiber is your fruit and veg, okay, so really important. So in terms of what a serving of fruit or vegetables is, it's something like a medium apple, orange, banana, it's say 2 broccoli spears, it's a medium orange, it's a medium pear, it could be a dessert bowl of salad, half an avocado, 7 cherry tomatoes. So you can see this is what a serving is. So for the general population, and for us with Parkinson's, and what's on the healthy food pyramid, is basically to try and get 5 to 7 servings of fruit and vegetables in a day. So we know that most people, there was a survey done by the Healthy Ireland Council that I was part of, that showed that only 25% of the population managed to get 5 servings of fruit and veg a day. Only 25. So 75% didn't get 5 a day. And since that survey, they've upped the amount to ideally getting over 7 servings a day. So you can imagine for us with Parkinson's, it's really important. So I'm just going to try some here. I don't know if it's going to work or not, but I did a little poll, and we'll see if people can do it. So if it works or not. So you'll see a poll in front of you, hopefully on your screen. Jake, can you see that?
Yeah, no, it's come up fine.
So what I want you to do is, I want you to basically, in terms, can you see the picture on the screen as well, the soluble fiber?
Yes.
Yeah. So what I want you to do is yesterday, I want you to select how many servings of fruit and vegetables you had yesterday. What do you think?
If for certain people that the poll is blocking the soluble fiber presentation, you can just click on the poll, hold down the mouse cursor and drag that it out of the way for you if you need to see the soluble fiber chart behind it.
So any of you who can enter. So basically it's a serving is a medium apple, orange, banana, for example. It is a dessert bowl of salad. It would be a bowl of vegetable soup. It would be 100 mils of juice. but only 100 mils of juice, that's 1 serving. So if you have 500 mils, it's not 5 servings. It's just to kind of get an idea of where we're at. Anyone being honest, they had none? So we only have 11 people so far, as 13 people have answered the poll. Anyone else want to answer in there? We've got 54% voted. Keep going. So far we have ahead at 4 servings a day, followed by 5, which is great. We've got, keep going. Any more polls want to be, anyone else want to enter? Okay, so we're looking here out of 66% of you that, what we say there, 32% are between 1 and 3 servings a day. And only there's no, excuse me, percent at the 7+. There are roughly 65% at the 4 to 5. So that's really good. So I'm just going to end that now. So I'll just share the results there. So you can see the results there that I was talking about. Okay. So now I'm just going to close out of that one. So we can see there's some room for improvement for a number of you, approximately 30% of the audience there to up your fruit and veg intakes on a daily basis. So I'm just going to go back here to the presentation. So the other way that you get soluble fiber in is through legumes. So your pulses, chickpeas, kidney beans, lentils, butter beans, all of those goodies, and also a good old-fashioned bowl of porridge. So your oats is another form of soluble fiber that is really good for helping to move the bowels also. In terms of insoluble fiber then, we're talking about, someone is trying to get in there. So in terms of your insoluble fiber, that is your roughage that I was mentioning. So that's your whole grain foods. So that's your whole grain breads, whole grain rice, whole grain pasta. It's very important that you're going for what I would say is brown foods. So if your plate, sorry, excuse me, it's white, then you're not getting enough whole grains in. So you can try different types of whole grains. It doesn't have to be rice or pasta. It can be buckwheat, millet, quinoa, wild rice, corn. All of those are different forms of insoluble fiber. So popcorn is also a form of insoluble fiber. So the other thing then is, along with the, sorry, I just have a little bit of a frog in my throat. It's actually part of the Parkinson's that can catch my throat when I talk. So in terms of the improving gut function, fluid is really important. So if you have lots of fiber in your diet and you don't get enough fluid, that can worsen your constipation. So you need to make sure you're not getting enough fluid as well. So the other thing is, it's shown that people with Parkinson's tend to be more dehydrated because it basically, if you're on levodopa, for instance, it can actually dehydrate you. So it's really important when you take your levodopa that you take, if you take a pint of water, say if you're on 3 tablets a day, which is quite the common amount people be on, you take a pint with each medication tablet. That's a good way of helping you to get some of your fluid in. So in terms of also fluid, people with Parkinson's tend to forget to drink. So it's like one of those autonomic systems that we forget maybe that we're not drinking as much. So we need to remind ourselves. So it might be at each meal that you would have a glass of water. When you are finished brushing your teeth, you drink a glass of water. So things to remind you to drink fluid. In terms of fluid, it can be any fluid. Obviously water is one of the best ones. And I'm just going to have to stop there for a minute and get a glass of water. Apologies, these are the joys sometimes of Parkinson's. So it's a prime example of not having hydrated and my throat giving out to me. So in terms of fluid then, One way that you can sort of tell whether you're dehydrated or not is to look at the color of your pee. So if your urine is pale, straw-colored and plentiful, it tends to indicate you're well hydrated. However, if it's very dark, it can indicate that you're dehydrated or maybe have had too much alcohol, because we know that it dehydrates us. Now, on that note, sometimes people can have their urine can be a sort of darker color because of the medication they're on. So you always need to check with your GP and neurologist that might be what's causing it. But if your urine is not plentiful, then it's an indication that you're not hydrated. So the other thing then, in terms of caffeine, you can have caffeine as part of your foods in terms of tea or coffee. And actually, obviously, as we know, is a stimulant. We advise that no more than 300 milligrams of caffeine a day. So that's roughly 3 cups of instant coffee a day. If you're taking the real deal coffee, you know, the heavy hitting coffee, that's 1 cup in the day would be allowed. So it can help to increase alertness, enhance, you know, performance. And obviously, as we all know, we can a symptom of Parkinson's can be tiredness. So caffeine can help in that way. And there is research sort of building to show that caffeine is actually associated perhaps with lower risk of developing Parkinson's. And there is some evidence to show that it may be beneficial in people with Parkinson's. So it's something that I would like to bust this myth, because in terms of, I think some neurologists feel that, you know, people shouldn't take because it might cause you to pee. Caffeine will only cause you to pee a lot if you're not a habitual caffeine drinker and you're not used to taking it. But if you're someone who's always drunk coffee and keep within the moderate amount, it will not dehydrate you. In fact, it will help towards hydration as part, once you keep it in the moderate stakes. Because obviously the flip side of too much caffeine is it can cause us to be restless. And obviously, you know, people with Parkinson's, with things like dyskinesias, tremors, the last thing we need to be is more restless because of caffeine, and cause insomnia, which again, for people with Parkinson's, can suffer enough with sleep issues. It can worsen tremors. It can basically stimulate our stress response, which again, we know with people with Parkinson's that stress is not good for our symptoms. It increases blood pressure and our heartbeat, and again, that is not a great thing. And increasing gastric acid in terms of causing stomach trouble. So in terms of keeping us up at night as well, for people just to be aware that caffeine can remain in the bloodstream for up to 8 hours. So you need to avoid it for at least 8 hours or 4 hours before bedtime. So some people are more sensitive to this than others. So you kind of need to keep a little diary for yourself, but generally try and keep the caffeine for earlier in the day. I can't talk about fluid without talking about alcohol, because alcohol is the thing that will dehydrate you. There's no two ways about it. The other thing is that depletes us of vitamins and minerals, because, you know, once you start going to the toilet after having alcohol, often you can't stop. And with that, pee goes out lots of vitamin and minerals, which we can be deficient in anyway, and we don't want to lose any more of. As I mentioned, dehydration, it also affects our food choices. So when people are maybe hungover, they don't eat as well. And binge drinking definitely scuppers our immune system. And for Parkinson's, there's a lot of evidence showing that it, you know, is related to the immune system. This is not a good thing. So in terms of just putting into context what a serving of alcohol is, so basically a serving of wine is 100 mils. Now, I don't know how many of you pour a glass and it's only 100 mils. So I know when I do these talks, people who don't have Parkinson's, and I usually have a glass of wine with me. So, I mean, effectively, you could sort of say that there is, you know, 100 mils of wine, probably even less. So most people would drink maybe, you know, 200 mils in their glass, or 250 mils. So that basically is 2.5 standard drinks in that glass of wine. So for men in general, we're advised to have less than 17 standard drinks a week, and for women, less than 11 standard drinks. So for a woman, it would be less than 1 bottle of wine a week. For men, in terms of pints, maybe, for example, a pint of beer is 2 standard drinks. So you're talking about 8-9 pints in a week max. Now, obviously, the other thing with regard to alcohol and Parkinson's is it can interfere with your medication. So certainly that's something we want to be, and it's not to be a killjoy. It doesn't mean that you can't have alcohol, but like anything, it's moderation, and probably even more so less alcohol for people with Parkinson's, just because it has so many knock-on effects for us. But it's not that you can't have any. The other thing then is, and I suppose the reason I kind of mentioned about alcohol is that with lockdown, the issue is in terms of people are on their own, and isolated, maybe on their own. Mood is going down, and often we will use other things to pick us up, and alcohol might be one of those things. But just to have an awareness that it may then have a knock-on effect in terms of your symptoms, and also alcohol intake itself can lead to depression. So there's kind of a multifactorial thing there going on. And I suppose the other reason in terms of just with regard to fiber and constipation is obviously, again, in terms of COVID, if you're isolating more, if you're not exercising, you're sitting more, say doing your job, sitting in front of the screen all day, your bowel needs to be exercised too. And so that's why it's important that you get up and move, but it's important that you're looking after the bowels in terms of what you're eating. And the other thing, again, in terms of COVID, people tend to, again, the mood is dropping. We know that, because it's a stressful time, and people comfort eat, and then we end up eating the foods that maybe aren't as healthy for us, and then we're not nourishing the bowel, and we end up constipated, and again, it's a vicious circle. So it's just kind of be aware of how COVID is impacting what you're eating. So the next thing then is vitamin D. So I felt this is really important for a number of reasons. The first one is basically from a COVID point of view. The evidence base is definitely very strongly building to show that people who are deficient in vitamin D tend to do worse in ICU or in hospital if they get COVID, than people who are basically have enough vitamin D in their bodies. And there is some evidence showing that people are less likely to get it if they have adequate vitamin D in their diet. Now, unfortunately, with the vitamin D, because of our northern latitude and because of winter now, we don't make vitamin D from the normal source, which is sunshine, on our skin. So coming into the winter, it's really important that we make sure that we get enough vitamin D. Also, people with Parkinson's, research would show that we don't take enough vitamin D in our diet, and also in terms of blood levels, it shows that we are lower in vitamin D than sort of control population. Vitamin D is also very important for our bone health, and I'm not sure if you're aware, but basically people with Parkinson's have a higher prevalence of osteopenia and osteoporosis, which is basically the bones are becoming brittle. They often said that's because people are indoors and maybe because of older population, but actually it's seen in younger people with Parkinson's as well. So there's something going on in terms of the immune system and the impact of vitamin D on bone health and that within people with Parkinson's. And the last thing is neuroprotective effect. There is some gathering information that vitamin D might actually have a protective effect as well. So just in terms of vitamin D, as I say, it's crucial to activate our immune systems and keeping them sort of healthy. And the way that we can get vitamin D is you can get it from fortified milks. You can also get it from tinned fish. You can get it from eggs as well. But often we will not get enough. I can say, okay, period, you're not going to get enough from your diet alone that you need from the most people I've seen. It's quite hard for people to meet it. So over the winter months, we generally advise that people would supplement. This is just to show you here what the levels of vitamin D are in the blood. So you'll see here less than what it tends to be in Ireland, less than 30 nanomoles per litre is basically vitamin D deficiency. Okay, and then as you go up, when you get over 50, that's considered being adequate levels. Okay. So in terms of, there was a study by the Irish Longitudinal Study on Aging, which is one of the biggest European studies on older people in Europe that's done in Ireland. So it's that 47% of all adults over 85 are deficient in the winter. 1 in 8 adults over 55 are deficient all year round in vitamin D. And 27, almost 30% of over 70s who were cocooning during the last lockdown were likely to be deficient. So that is at the level of which you're at greater risk of end up in the hospital with COVID and having worse complications. So really important to get the vitamin D. So basically, again, the reason why it's really important for people with Parkinson's is that there's a higher risk of vitamin D deficiency if you're housebound, little sun exposure, which obviously this time of the year we don't, and maybe not eating enough food. And often with Parkinson's, especially as we get older and the disease might progress, the appetite can be affected. So we're not taking enough food, and we know in terms of the vitamin D, foods are quite limited. That not everybody eats oily fish, for example. So we know as well that currently over 91% of older adults over 55 in Ireland do not take a vitamin D supplement. That's in general. That's not just with Parkinson's. And only 4% of men and 15% of women take a supplement in total. So pretty poor, and we all need to be doing it more, taking the supplements. People who are obese, physically inactive, have asthma or chronic lung disease, again, tend to have a higher risk. And these are the things, unfortunately, that are associated with a higher risk of getting COVID as well. So, and also in terms of what we call the Black, Asian, minority ethnic group as well, because of skin color, basically means that they tend to, especially when they move, if people move to Ireland, but generally darker skin means that you are at risk of being more deficient. So what do we advise in terms of vitamin D? You should be getting in 10 micrograms of vitamin D a day. For those of you who have insufficient, deficient vitamin D levels, you're probably going to need higher to rectify that deficiency. So 10 micrograms won't do it, but you need to actually get a blood test to test for that. You need to talk to your GP or neurologist. And I would really advise that you do that. And you can get blood tests done in the current climate, and they should be doing it, particularly in people with Parkinson's, because we obviously have more risks, not so much of developing COVID, but of complications if we get it. So I would definitely advise that you do that. I probably won't be thanked by your GPs, but so be it. So in terms of the other thing, there was something else I was going to say, but in my head. Okay, so the next thing then is your bone health. So in Ireland, 1 in 2 of the women on this call who are over 50, and 1 in 4 men over 50 are at risk of osteoporosis. Anyway, but people with Parkinson's, as I mentioned earlier, also have a higher risk. So it's kind of a double whammy. So basically, in terms of this image shows you here, in terms of the left-hand side shows you how the bone should be, and then you'll see the right-hand side image is how it gets brittle. And obviously, as we know with Parkinson's, one of our, because of the motor symptoms, a big risk is falls. And one of the things, if you fall, it can be hard to recover from. So we want to keep our bones as healthy as possible to avoid us ending up having complications from a fall. So vitamin D is really important to keep the bone health strong. Also is calcium, which besides helping prevent osteoporosis, aids muscle and nerve function, and also our blood pressure as well. So in terms of calcium, we get it from our dairy foods in the main, is the best absorbable form of calcium. But for those of you who don't take dairy, you can get it from your sardines, from your kidney beans, or you can get it from things like, for me, if I'm being celiac, you can get it from things like gluten-free bread. So generally speaking, in terms of your calcium, you need to be getting in about 1,000 milligrams a day. If you've osteopenia or osteoporosis, you might need a bit higher than that. So you can take a vitamin D and calcium supplement. So things like Calci2 D3 Forte or Idios are ones that are used quite commonly by dietitians with people who need to take calcium or vitamin D supplements. So in terms of then protein, just the reason I have a picture here of a turkey is, I think I don't know how many weeks it is to Christmas, kind of scary, but it's coming up soon. And basically in terms of the reason I have a picture of a turkey is that, what do you feel after you've had your turkey dinner? So generally speaking, besides being absolutely stuffed, you often feel sleepy. The reason being is that basically protein, and turkey in particular, contains a thing called tryptophan, which is a precursor of the neurotransmitter serotonin, which has a big impact on various things like anger, aggression, body temperature, mood, sleep, and appetite, all which are symptoms and things affected in Parkinson's. Also, tyrosine, which is another protein amino acid, prompts the brain to manufacture norepinephrine, but most importantly, dopamine, obviously, if they're lacking in. So protein is really important for us to have in our diet. It combats fatigue because it contains iron. And it's actually shown in some research that anemia may be also a prodromal symptom of Parkinson's for some patients. And some people with Parkinson's have anemia and need to have it rectified. Because obviously if you're anemic, that's going to heighten your fatigue. Protein is important as well because it helps keep you fuller for longer. Those of you who might be on the higher weight side and trying to bring the weight down a little bit, protein helps you feel fuller for longer. And also really important for everybody in terms of a body weight point of view, it's not just about the weight on the scales, it's actually what your body composition is like. So we want to make sure that we retain our muscle, and protein is really important for that. And as we age, over the age of 30, we start to naturally lose muscle unless we exercise and we eat adequate protein to help build the muscle alongside the exercise. So there's a thing called sarcopenia, which naturally happens as we age, and we want to avoid that happening as much as we can, but it is very prevalent in people with Parkinson's. But you know, some of the research coming out in terms of research trials would show that intervention with a dietitian and doing nutritional therapy can actually help to ameliorate that or to reduce the risk of that happening. The other thing as well is your immune cells are made from protein, and an inadequate intake of protein. So that's your chicken, your fish, your eggs, your pulses, those your meats, those kind of things are your proteins, your nuts. So basically, inadequate intake impairs your immunity, and then you know if you're not getting enough protein, you can get increased infections. And also, people who are at risk of protein deficiency are people that maybe they're trying to cut their weight, and it's maybe in the COVID climate, and they're thinking, oh, I need to lose some weight, even with Parkinson's, and restricted too severely can affect your immunity. People who are well with Parkinson's thinking, oh, maybe I should go out here, basically a vegan diet or a vegetarian diet is good. But what they do is they go on what we call a pseudo-vegetarian. They forget their protein, they just eat vegetables, and they forget that they have to replace the meat with nuts or soya, tofu, or you know, pulses, things like that. And also those of you maybe with Parkinson's who are doing a lot of marathons and exercise, because obviously we know one of the only things at the moment that's showing signs of slowing progression is high intensity exercise. So just be careful there as well that you are getting an adequate protein in as well. So as I mentioned there, iron that's in meats and fish and also vegetarian protein sources is your iron. It's effective for mounting your immune response. So really important that you get your protein in. Now, however, there's a little caveat. In terms of those people who are on levodopa or Sinemet, protein foods can interfere with the absorption of those medications in the gut. So it's very important that you look at taking your levodopa tablets half an hour before your meal or an hour after your meal. So that basically allows then for your levodopa to be absorbed before your protein comes in there and starts to compete and block the protein and the levodopa from being absorbed. So you may find that your response to your medication improves if you put that in place. Not everybody has a response to it. Sometimes people who are younger onset, earlier in the disease, may not find the impact, but as they progress along, might find the impact greater. And certainly with sort of mid to sort of further progression, definitely you need to be having a look at that before you start upping your meds. So what I would say is, you know, you need to look at things like your bowel function, your constipation, your fluid intake. You need to look at things like your protein intake. So things that may be interfering with your medication before you suddenly get whacked up, you know, to a higher level of medication without sort of checking that the baseline is working for you. Avoid drinking milk with meals. So milk is really important, as I mentioned, in terms of getting your calcium in. And if it's fortified, you can get your vitamin B from it as well. However, it obviously contains protein. So having milk with your meal. So for those of us who might be used to, and I grew up with drinking milk with my meals, it's something that you just need to change around your timing. And the other thing is, and I'm just going to touch on it, there's a thing called the protein redistribution diet, which basically means that sometimes what you can do is change your protein intake so to have more of it in the evening time when you don't mind being off more. So in particular, when people have more severe symptoms, maybe a little further progressed along, and want to be on so they can go for their walks and be more active and do things during the day, so they can go lighter on the protein during the day and then top up in the evening where they're going to be sitting more and don't mind being a little bit more off. So that's something that you can look into, but it really needs to be done in tandem with a dietitian. So just to show you here in terms of fruit, this is a typical Irish steak. This is really the kind of serving size. We're talking about 3 ounces. I don't think many people have a 3-ounce steak. And also this very typical Irish diets. So you can see why this might be interfering with your medication, and then therefore might be interfering with your symptom control during the daytime. So it's about trying to actually reduce your protein portions in general, particularly of red meats, not to overdo it, not to cut out red meat, you don't have to do that. But we're only talking about 3 ounces of red meat a couple of times a week to keep your iron levels up. The rest of the time it can be fish and eggs and meatless versions of protein. But the main thing is to get lots of your vegetables. So that's really what your plate should look like, more than this. Okay, so the other thing in terms of protein, just because I know for a lot of people, they're probably, finding it hard to sleep, maybe with COVID and the stress of it all and the routine of the day, and is that protein can actually help to promote sleep. So in terms, I mentioned there, the tryptophans, your turkey, things like your pumpkin seeds, fish, eggs, all those kind of things. Other things are kiwi fruit can actually help as well. And also, so having something that, sort of carbohydrate and protein together as a snack before bedtime can help you to sleep better. So something like a bowl of cereal, Weetabix with milk, or banana and yogurt. Remember Sonia Sullivan talking somewhere or being interviewed, and she found that bananas helped her sleep, and bananas contain tryptophan as well. So the things that impair your sleep will be eating very late at night, eating heavy meals, drinking coffee, as I said, too late, and alcohol. So then just in terms of fats, I think it's important to mention this again in light of COVID, and that is basically omega-3 fats are essential. They're also showing that people who have a low level of these have a higher risk of depression, as we know with Parkinson's. Depression and anxiety are prodromal symptoms and continue on in Parkinson's as well. So basically, omega-3 fats tend to also inhibit the inflammatory response, and we know with Parkinson's basically is an inflammatory. There's a lot of things that show it's an inflammatory condition. So omega-3 is what we want to get into our diet to try and dampen that inflammation down. So where can you get it from? It's from your oily fish: salmon, sardines, mackerel, kippers, trout, herring, fresh tuna, or through omega-3 oils, or other non-fish sources like linseed oil, walnut, peanuts, etc. Now, just in terms of omega-3, there is a lot of evidence building to show that it is beneficial for us with Parkinson's. But for the men in the audience, there has been some research to show that having too high levels of omega-3 supplements in our diet can be associated with aggressive prostate cancer. So just, I suppose that's why it's really important to speak with your GP about these, taking high dose supplements of any kind, but also with a dietitian who understands what kind of amount that you can take in your diet as well. And obviously you can talk to your pharmacist as well. So I just want to show you here, just touching on weight loss. This is a video of a PD Avenger called Matt Eagles. He was diagnosed with Parkinson's. He lives in the UK at the age of 7. He's living with Parkinson's now for 45 years. So just showing you here. So Matt suffers from dyskinesia, as you can see here, and he's trying to eat his meal. So it's just a lot of people, not everybody suffers from this, but some people do. And a lot of younger people suffer from it. Interestingly, a lot of women suffer from it as well. Obviously, tremors is another thing people suffer from. So you can see it takes a lot of effort to eat the meal. So in terms of weight loss, it's just to show that you can see the energy that's been used up there. But that basically, your body is using calories. And the same with the tremor. And actually rigidity, so if you just literally have rigidity in terms of being stiff, that also uses what we call a stress level in the body that uses up energy. So all of these things can lead to weight loss. So you need to, be very cognizant of that, and you need to keep an eye on your weight, that it doesn't drop, particularly people who are older, who maybe the symptoms are worse. And family caregivers need to weigh someone maybe once a week and check that their weight is stable and is not going down. If you lose 5 to 10% of your body weight in 3 months, that's alarm bells going off. You need to get intervention. So really important to keep an eye, again, in terms of this climate. Some people might react to stress by overeating, and other people might react to stress by going in on themselves and actually being apathetic and lacking motivation and don't want to eat and those kind of things. So do get help around if there's any signs of weight loss. and similarly weight gain. But I'm not going to go into weight gain here, so we don't have enough time. So just showing you here, there are resources out there in terms of, the food pyramid. There's a really good sort of chart to sort of follow in terms of getting the basics right. But the evidence in terms of what kind of diet people ask, the one that's showing the most benefit in terms of preventing Parkinson's and maybe helping in terms of Parkinson's progression is a Mediterranean type diet. And again, I won't go into it in detail here, but basically it's the same thing in terms of eating plenty of your fish, your fruit and veg, healthy whole grains, plenty of fluids, keeping the treats down, watching the alcohol, and exercising. So the last thing I'm going to touch on, and I know I've kind of gone way over, but is swallowing. So just to show you here in terms of a lot of people have swallowing issues, and even those of us who are early diagnosed in the early phases, up to 80% can have swallow problems. And the reason I mention this in terms of COVID is, again, it's not so much us maybe having a higher risk of developing it, but if we get it, you have more risks because of swallow implications, okay? So what I would say is those of you who have not been referred to a speech and language therapist, I would ask. You'll probably be told that you won't get one because of COVID, but if you don't ask for it, you definitely won't get it. And we need to stand up for ourselves and ask for the services that we need, whether COVID is here or not, because COVID's going to be here for a while and we need to be looked after. So just showing you things, medication can affect dysphagia, which is basically swallowing problems. So thirst and dyskinesia, which is what Matt was suffering from there. Wearing off, the swallowing basically worsens in the off state, so there's risk of aspiration there, so going down the wrong way and causing pneumonias. And there are just certain types of Parkinson's symptoms that basically can worsen the swallow. So you'll see this picture, won't dwell on this, but it's showing you that there's lots of different parts of our swallow that are affected. And the biggest thing that came to Kyoto from to me was that basically one of the biggest killers, unfortunately, of those of us with Parkinson's is basically dysphagia swallow related. Okay, so that's pneumonia, etc. So we really need to stand up and get care in that area. So I'm just acknowledging the people who I took some of the detail off during the presentation, and I'm just going to finish there. And sorry that I went on a bit longer, having to have the water break. So I'll just stop sharing my screen and then we can get to questions.
Thank you, Richelle. That was very insightful.